A mastectomy is removal of the entire breast. I think a lot of women will elect to have a mastectomy, one, because they think it will increase their survival, but also they're making that decision based on fear. So what many people don't realize is that breast preservation followed by radiation therapy is equivalent to a mastectomy in survival stage for stage. So in many situations, doing a mastectomy does not give you an increased survival advantage. There are certain clinical situations where mastectomy is preferred, so it's not wrong to do a mastectomy. But with the increasing use of screening mammography, we're identifying breast cancers that are quite small and early cancers that are highly treatable and curable. Besides mastectomy, for breast preservation, we can do a wide local excision, which is commonly known as a lumpectomy. But if a woman has a larger tumor and we know that she's going to require chemotherapy and she'd like to preserve her breast, then sometimes we give chemotherapy first to shrink the tumor to facilitate breast preservation. There's another procedure that we also offer called oncoplastic surgery, which is where we can remove the tumor with a margin of normal breast tissue and we can lift and reposition the nipple, basically doing a breast reduction and reshaping the breast, sometimes to the point that the patient finds that her breast is aesthetically better than it was before they have cancer. We can do the opposite side, so we don't want to have asymmetry. So that's typically covered by Medicare and Health Fund, the symmetrization, because we don't want to leave women asymmetrical. You're born with your breasts. If you can keep them and live the same amount of time, why would you choose a more radical surgery which has more risk and potential complications and morbidity and be able to have a great outcome as well? I believe a woman doesn't have a choice in having cancer, but they do have a choice in how they choose to respond to the cancer, because ultimately they live with the consequences of those decisions that are made. So I think it's quite empowering to inform a woman of all of their treatment options and to give them some power back to make those decisions for themselves as to what surgical option they can live with.
Care to Share, brought to you by St Stephen's Hospital, Hervey Bay, because your health matters.